you know, the healthcare system is so incredibly complex that it's very hard to think about, you know, how do we avoid this? And I think one of the biggest problems is there has to be kind of a systemic approach or to making sure that each and every medication gets screened for necessary dosing adjustments as applied to each and every individual patient. And one of the methods that kind of helps, and I like to use, is kind of like a checklist approach. You know, for each patient, I've calculated the Cockcroft and Gault creatinine clearance, and for each one of the drugs, I have asked myself, do they require an adjustment? That checklist approach has been endorsed by the World Health Organization based on a paper by a Harvard professor who is a surgeon named Dr. Gavandi, I forgot, Arun Gavandi, and he wrote a book called The Checklist Manifesto. Basically, it kind of says, you know, when you do a surgery, it's so incredibly complex that it's very easy to miss something. And so you should have a checklist approach, much like they do in aviation. Medication management should be also sort of a checklist approach, and one of those checklist items should be appropriate renal dosage adjustments.